Congratulations! You made it through nursing school, and after the many days of sleepless nights and many days of uncertainty, you've conquered the mother of all tests, the NCLEX. Now it's time to enter the real world of registered nurses. How are you feeling? Excited? Ready? Ecstatic? Or are you afraid, questioning your ability and unequipped? Have you heard of the phrase nurses eating their young? Perhaps in nursing school, or during the process of filing up tons of job applications. What does eating our young mean in nursing? Does it still exist? Why? What are the effects of it? The nursing profession is known to be a profession for compassionate individuals who desire to care for others. It is consistently ranked as the most honest, trustworthy, ethical profession. In the same way the public expects from the nurses, new nurses expect to work in an environment where civility, kindness, dignity, and respect is given by other nurses. The ANA Code of Ethics includes professional relationship expectations of nurses. Nurses eating their young is a common phrase referring to sometimes high levels of hazing or initiation new nurses experience from more experienced co-workers. It is also known as horizontal or lateral violence. Nursing school is challenging, much more in a job with high-stakes environment where people's lives are on the line. Nursing is a career associated with high stress. This is why the term burnout is commonly heard in the nursing profession. Some studies have shown that nurses have higher levels of stress compared to the members of the armed forces. In 2006, 29% of nurses working in the hospitals report high role overload, insufficient time, requiring nurses to arrive early, work during break times, and leave late for work. Now you might be wondering, how does this connect to eating our youngs? With the high levels of stress, nurses are in need of an outlet, and unfortunately, one way this is projected is through horizontal violence, or in a much simpler term, bullying. Horizontal violence is not new to the nursing profession, and neither it is exclusive to new graduate RNs. It stems from the history of the female-dominated nature of nursing, compared to the male-dominated physician's counterpart. Nurse bullying or harassment has been present since the healthcare became organized and structured. Nurses receive little to no power in voicing out their opinions with patient care and merely seen as subordinate to other colleagues in the interdisciplinary care. This is the hazing initiation of nurses into the healthcare profession. Unfortunately, nurses have carried over the idea of power entitlement as they accumulate years of experience in the profession. According to ANA, about 60% of new RNs quit their jobs within 6 months of being bullied. 1 in 3 new graduate nurses consider quitting nursing altogether because of abusive or humiliating encounters. In addition to the feeling of powerlessness and lack of control of the situations they face with patient care, greater tension is created now that hospitals require BSN graduates, placing new RNs to work with more experienced but less educated nurses. Some behaviors that constitute horizontal violence are criticizing, intimidation, blaming, fighting, refusing to lend assistance, public humiliation, withholding behavior, and undermining efforts of targets. These include actions such as name-calling, threatening, gossiping, isolation, ignoring, unreasonable assignments, using silence, and making observable physical expressions like eye rolling. So why new graduates? First year is important for a confidence building phase. New graduates face role stress, role ambiguity, differing expectations, values, morals, and integrity. They face constant testing of competence and need to adapt to a new culture. New graduate RNs reported feeling undervalued and neglected. They constantly feel that they are in the way than being a member of the interdisciplinary team. Not knowing has become a weakness and used to undermine new RNs instead of being expected from a novice nurse. What do new nurses complain about in their first 2 years of practice? A survey conducted by ANA summarizes some of the themes new RNs go through during their first 2 years of employment. Some of these themes are as follows. Pressured time. The inability to finish work in time with little or no support from peers or supervisors. This also includes unpaid overtime. One challenge that new RNs face today is having shortened orientation time due to the nursing shortage. The complaints about the reality of the nursing profession. Some of these complaints are, but not limited to, not treated as professionals, unheard voices, employers determining what is safe practice through monetary worth, management having no consideration for the nursing staff, including assignments and high patient to nurse ratio. Growing weary. Due to the patient to nurse relationships and professional relationships, primarily consistent verbal abuse, yelling, rude, and poor behavior not just from physicians, but more so with senior nurses. In the defense of some nurses, new graduate nurses experience these for them to learn. They give them opportunities to experience new and hard things as soon and as much as possible. What is considered as passing the buck is their way of opening doors of opportunities to learn and strengthen new RN skills. But with less or no supervision, this causes more harm than growth. Unfortunately, studies show that being unnecessarily hard on someone during learning phase produces incompetent nurses. Renee Thompson, an experienced nurse for more than 25 years, a nurse educator, nurse executive, and an expert on nursing incivility, once said, "Some mentors believe that being hard on new nurses help them become competent and stronger care providers. But the problem in that theory is that competence comes from confidence. By shattering the new nurse's confidence, the mentor is actually doing more harm than good." What does it take to transition from being a novice nurse to advanced beginner, competent, proficient, and ultimately an expert? New graduates are in constant need of guidance. Study shows that risk for patient safety is reduced when new graduates are paired with experienced colleagues. During this transition phase, new nurses express a need for mentoring, guidance, and acceptance from senior nurses, but instead, they are left questioning their ability to withstand the realities of the practice. They recognize the need for guidance from others, but now mentoring is more defined as gaining experience in the front line, most of the time alone. Some accept this idea, but most experienced nurses are willing. Generally, nurses have a sense of love and hate relationship with nursing. It is truly a highly fulfilling job, but the circumstances at the workplace make it difficult to think so. Experienced nurses face almost the same problems as new nurses: being pressed in time, learning new things with new technological advancements, feel sabotage in acquiring resources, and exhausted in pushing for better patient care for patient safety. For the same reasons, experienced nurses unconsciously participate in eating their young, because they don't have enough time and resources to fit every work they have, and let alone worry about mentoring a new registered nurse. This only adds work, with little to no compensation, and while also using up their time and energy that they can least afford to lose. Healthcare is lacking willing mentors for new RNs because of the inflexibility workloads that do not accommodate or recognize the time required to mentor. Even some managers are reluctant to add mentoring to the already busy workload of nurses. Instead, new graduate RNs are pulled to fill vacant positions. The nature of work for new grad RNs require job-ready nurses, even though experienced nurses still reports difficulty in meeting the patient care standards in their workplace. With all these in mind, it is just right to ask the question, how can a new grad RN receive support from mentors without receiving the support mentors need? As a summary, these new graduates go through 6 stages during the phase of transition: vulnerability, getting through the day, cope with moral distress, alienation from self, cope with lost ideals, integration of a new professional self-concept. They recognize the essential ethics of nursing as being respectful and caring, yet their working conditions are making it difficult to maintain ethical standards, leaving new RNs frustrated, powerless, and ultimately make a change in their perception of self. This is one of the reasons why there is a vicious cycle of nurses eating their young. Those who survive and strive to continue their nursing careers were once oppressed, or even are still oppressed. The cycle continues as the oppressed grow with a tendency to act upon each other as an outlet. So, what are the effects of horizontal violence in new graduate registered nurses? Some of these effects include decreased sense of well-being, physical health complaints, depression, low job satisfaction, compromised patient safety. It also contributes to nursing shortage. New graduates experience horizontal violence report higher incidents that result to frequent absenteeism and eventually consider leaving the profession altogether. Bullying is a repeated pattern of destructive behavior in attempt to do harm. Hazing is torturing a new member through physical or emotional harm to own membership. Nurses eating their young. Is it hazing or really bullying? Regardless of what it may be, is this kind of rite of passage necessary in shaping our new nurses? As a conclusion, nurse-to-nurse violence is still prevalent, though less reported today. Part of the reason is because harassment, hostility, violence at work has become a norm and is widely accepted and expected from new registered nurses, and even with student nurses. Unfortunately, this creates a different perspective of the nursing profession, having less job satisfaction. Though it's been studied that transition to practice programs help reduce these incidents, it still does not eradicate the presence of nurse-to-nurse violence. The horizontal violence within the nursing profession must be stopped first, so that new graduate nurses are not treated the same way when entering the workforce, and at the same time, this puts a stop in this vicious cycle. The eradication of horizontal violence must stop within the hospitals and be taught early in nursing schools. The real solution lies behind the reformation of the nursing profession, allowing more experienced nurses to mentor and giving space to new RNs to grow with guidance. How can we take part in this reformation? Experienced nurses, new nurses, as well as nursing students should also take part in this through speaking up and reporting such incidences and voicing out their opinions. Our goal is not to just merely satisfy our nursing expectations in our job, but more importantly, to take part into making the healthcare system better and promoting patient safety. Has anyone rejected you when asking for assistance? Are you ignored? Is your voice heard? Do you feel overly worked and face situations where you had to compromise patient safety? If so, take a quick look and reevaluate. Does hazing still work, or is it really a subtle form of work violence? Know that these behaviors are not acceptable. Be aware and take part in ending these abusive behaviors and in implementing a clear zero tolerance policy.